this episode of Nurturing Wellbeing with Kurt Kelly, I had an opportunity at our conference to actually interview Nathan Scott. You're going to enjoy this conversation. Nathan is currently the Child and Family Wellbeing Systems Coordinator for the Florida Department of Health for the Florida 12th Judicial District, which serves DeSoto, Manatee, and Sarasota County. And what Nathan does is he brings different groups together in providing services for our children and families. We believe that this is a great model, and we are looking to expand this all over the state of Florida, which is what our lead agencies work with us on doing. I think you're really going to enjoy this episode with Nathan Scott on Nurturing Wellbeing with Kurt Kelly. Nathan Scott, it's great to have you here. Saw you before you came in. We've had an opportunity to talk a little bit. Your experience and credentials is exceptional. But what I want to do today, I want to be able to talk a little bit with folks about what it is that you're doing in the Sarasota area, and tell us a little bit about, first of all, how we got started into this, and then we'll talk a little bit about how it's actually changing things there in your area.
Sure. Well, first of all, thank you for having me, Kurt. Really happy to be here. So I'll start with kind of the history of the position that I currently hold. It's the Child and Family Wellbeing System Coordinator. And the interesting thing is it's with the Florida Department of Health. So it's not with DCF or a CBC. Right. Now, my history is my career has been with case management organizations and CBCs, but for the past 9 years, I've been in this role. And this role was created back in 2008, 2009. And it was the Honorable Judge Hayworth, who's retired now, Secretary Sheldon at the time. There were the community felt there were some transparency issues going on with the child welfare system. So they created what they called a transition oversight team. They had a few recommendations come from the transition oversight team that they sent back up to Secretary Sheldon. And my position was one of those recommendations. And the other recommendation that's relevant is that they decided to consolidate the three counties' community alliances into one circuit community alliance and named it the Family Safety Alliance. So my position was born. I'm the staff person on our community alliance. And so it's like a third party independent oversight position. But my predecessor took a lot of the role of oversight and really helping with the transparency piece. So I was lucky when I took over that it's really collaboration, partnership, innovation, community building, cross systems collaboration. So that's kind of the history of it in a nutshell.
You know, when you start talking about this cross systems, at the very time that you're talking about this, you mentioned Sheldon and so forth, Secretary Sheldon with DCF. All right, I was the acting chair in the Florida legislature for Healthy Families. So we heard about this transition, and I'm really kind of excited as you were telling me about that. I'm like, oh yes, I do remember that. When you start working with children, family issues, there are multiple agencies that end up sort of working together or sometimes working against each other. And the community is like, I'm not sure how all that works. I thought this is, when we started talking about this, I thought this is a really good idea, because what it does is it allows the cross collaboration and bringing the resources and conversations from different agencies, all infused by the community. Let's talk about the successes. How's it going?
Yeah, so we've had some excellent successes, and it's really all about community collaboration. I have to give it to our CBC, Safe Children Coalition. They are just open to hearing from the community. And, I'll back up a second, Kurt, because when I was working in case management and case management organizations and those things, and with Safe Children Coalition at the end of that piece of the career, I think our staff felt like in the child welfare system, child and family well-being system, that they were doing all this work alone. They're kind of, left to do it all by themselves, and they face barriers with school system or even the court system. Even though they're there, they feel like it's like you said, it's kind of a combative feeling, And so what I really felt when I first started getting into the community alliance at the Family Safety Alliance, I'm like, we have a lot of very interested people in this topic, in our kids and families, from the school district, from the courts. We had some judges there when they can make it. We have some attorneys there when they can make it. From different organizations that coming from inside the system and just taking that small step outside, I was like, we have an opportunity here to really build some collaboration across the systems, right? So one of the things I really wanted to do when I first started was some cross systems training. So I tried to connect with these some of my colleagues that were coming to the alliance meetings from the school district and saying, "Hey, is there an opportunity that I could come and do some child welfare 101, let you know what's happening in the child welfare system and how you can be a part of the solution?" And they were very interested. And at first, I think they were really interested in knowing what's going on with their kids and with their families. What zip codes are kids getting removed from? Why are kids getting removed? But then when we started talking about how you can be a part of this, how you on that prevention piece, I know we might talk a little bit about prevention, but I think a big success is that they knew that they could reach out to me, right, and say, we think this kid, we're thinking about calling in a report, but it may not be a report. Is there something else we can do? Is there some other things we can do? And so we really, I'm using the school system because every year now, except for during COVID, I get invited to the Sarasota School District to talk to their school psychologists, their school social workers. We do child welfare 101, what's happening, kind of the state of the union, kind of get them involved and asking questions. And they have my email, they have my phone number, and when they have questions, they do reach out.
Sometimes, and especially so, I before I got in the legislature and I was in that situation where I told you about, I was on the Marion County School Board. And literally, the school system becomes really the first eyes and ears. And there is a question. My wife was a school teacher, my mother, my grandmother. I mean, I come from a long, long history of educators. And literally, people that are in education usually do this just because they have a real desire to impact children's lives and to do it positively. And then they begin to see things that are happening and they have to make those determinations. And it's not an easy decision. So I think that, like we said, the cross collaboration, the knitting of the different organizations, and even the responsibility of how you do be a reporter, you're an automatic reporter, and all of those things. All that's important because somebody could misinterpret a situation, and then that gets difficult. So it's going well. Let's go here. Let's go to how well. Where do we need to improve, or is there ways we could grow it and improve it, and then how do we move it out across the state?
So I think in terms, I think that the staying with the cross systems collaboration theme, even thinking outside of the box, where I think one of our biggest successes has been is engaging our philanthropy friends and our community foundations. And I don't know if we had done that before. Maybe we did, but I feel like we really, just by the virtue of my position, I'm not managing cases, I'm not managing folks, I'm not operations. I am just a single. I don't have anybody. Nobody reports to me, so I have the ability to kind of bob and weave and go out and make relationships. Relationship building has been the key to the success of this position, both with my predecessor and myself, and just getting folks like our foundations involved that are really interested in this. And then, man, if you think about just from a whole different perspective of different solutions, I'll give you an example because one of the things that we really want to look at is trends. And the biggest trend, and I don't think this is a surprise to you or anybody else that might listen to this, for us right now are these really high risk, high need teenage kids coming into care.
High acuity.
High behavioral health needs, multiple criminal justice, interactions. And unfortunately, we're not. It's not because of abuse or neglect at the time. I'm not saying it hasn't happened in the past,
Sure.
but it's really the behavior, and it can't be managed by the family in the home. And so they come into care, and we're having difficulty managing them as well. And so we went all hands on deck, and again, going back to that idea of being alone in the child welfare system and having to manage all these things on our own internally. What I did with our community alliance, we kind of just shut down the agenda for the last two meetings of last year of 2023, and we invited the school district, we invited the law enforcement, we invited our CSUs, our crisis stabilization units, to come to those meetings, and we asked them, "Hey, we're seeing this. What are you guys seeing?" And then as they were talking, everybody on that call, we usually get 70 to 80 folks, per meeting, realize this is not just a child welfare issue, right? This is happening in our CSUs. The population that are coming in are more high acuity. We're seeing more kids come in. Law enforcement seeing the same thing. The schools are seeing the same thing, and they're seeing it earlier. So it was a great example of how everybody. It was like the light bulb went on, and we were like, okay, we got to do something. And so we have decided as a community to establish these work groups on how do we prevent families from getting into crisis in the first place. And then on another work group on these kids themselves, how we're not doing really well with those kids, unfortunately. So how can we do better? And I'll tell you, we just finished up our throwing the spaghetti at the wall, and we have 150 different unique ideas and no idea is a bad idea, but we have 150 unique ideas from the community. Of course, our child welfare agencies are part of that on the prevention end of things, and 100 ideas on what to do with those kids that are already in care. Now we're going to try to whittle them down. We got a couple more. We gave ourselves a 6-month target to come up with some strategies, maybe 5 to 7 big strategies that we want to deploy out to the community. I'm going to go on a little tangent because one of the benefits of my position is my contract is with both Sarasota County and Manatee County governments, right? And so I have to present to the Board of County Commissioners every year as part of my contract. And so my goal is, our Children's Services Advisory Board in Manatee County is to take our community developed strategies to those leaders and say, hey, we came up with these 5 or 7 things. You guys are our county leaders. This is like an a la carte menu? Is there anything here you're interested in? Maybe there's a starter, maybe the dessert, but how can you get involved if you want to? Same thing with our philanthropy partners. So that's our strategy, but it's a community driven strategy. And I think our child welfare friends, our CBC friends, are just happy to have partnership, like true partnership, and kind of trying to move the needle, because we all know we have to do it.
So that
Hopefully that answered your question.
no, not only did it answer it, it led me into what you are doing is exactly what Florida wanted to happen with the community-based care modeling that was in the child welfare arena. And we had a lot of bad experiences before this. We really, the one size fits all out of Tallahassee or Washington doesn't work. And we understood if you could get community leaders, community boards, community governmental entities, and now it's all this cross collaboration that's coming in, and then you bring in I mean, we have to deal with the federal government sometimes and some of their requirements. We deal with different agencies. Everything you said there is, if you could get everyone there combined in their thinking, instead of saying, well, I come from this perspective, you're going to come from that perspective. Come from the perspective of how do we, A, prevent this child from coming in if that's possible. Secondarily, if we know about them, what can we do to get it done right quickly? And then if they do have to go into the system of care, how do we keep them from getting in there, being long term? And how can we get the families reunited? How do we get communities wrapping around them so that once they get reunited, that they're going to stay united in their work together? So it's a community solution. Brother, this is what you are doing is the heart and soul of what community-based care is all about. I worked in government. You work in government. Okay. You went to the USF. Good. Me too. Okay. So I got my master's there. And I love having academia and I love having government involved. But I believe when you incorporate all these elements in, you actually come up with real solutions. And there's not one size fits all solution ever. And it's all this is individually moved and make. That's why you get all the communities. I love that you're getting philanthropic and even the business community engaged in this, because that's when we can really see some great solutions. Um, with that, I did ask you, how could we, now that you're having successes, and obviously you're documenting the successes, you have to go before a variety of people and say, this is why we're being successful. How do we take what we've learned here in the Sarasota area? Oh, and by the way, Sarasota was where we started community-based care, right? So how do we, and that was 25 years ago, I guess 25 years ago when we started that modeling there. How do we take this, what you're doing, and move it across the state?
Where we've started a little bit of that. So I have 2 colleagues in position now, one in Hillsborough County in a very similar role, and then one down in Miami-Dade County in a very similar role. I of course am partial to my being with the Department of Health, and I'm sure they're partial with theirs. But the 3 of us got together about a year ago and worked with our philanthropic partners from Sarasota Manatee to connect with a colleague from the business community to really help us do a survey across all community alliances across the state, right? And to find out kind of how can we come together to talk about shared barriers and shared goals. And so I would say maybe let's just say a year, we established what we're calling the collective, but it's the collective of Florida Community Alliances, and we've been meeting every other month. We just met last Monday, I want to say. From those discussions that we've been having, and no surprise again, the number one issue everybody's bringing up are these high acuity kids. But what from there to your question, We know that Palm Beach County went back to their community and talked about a position similar to ours and mine, and they are in the process of voting at their children's board level to deploy that position in that county. And we also know Pinellas County is doing the same thing. So it's starting, and I think that, I think both of those counties, they have children's boards, so they have a dedicated millage to be able to fund this. So I think it might be harder for rural counties or circuits that have more, that might be more difficult in other areas. But I think it's starting, and I think maybe our goal would be how can we help the other communities that maybe want a role like this? Because I'll tell you, our DCF friends, our community development administrators that are running the alliances across the state, they could use some help from positions like ours so that they can actually go back to doing the community development administrator role rather than facilitating their alliance. And then having that community person to be able to bridge the child welfare system and the rest of the community is key. And I will tell you, there's so many successes that come from just me being able to say, and nothing against DCF, but I think everybody would understand that when I'm talking to people with lived experience or somebody who's had an experience with the department, when I say I'm not with the department, it just kind of brings down some barriers, brings down some shields. So just that, it doesn't have to be with DOH, right? It could be with anybody, children's board or what have you. But I think it really truly creates the bridge. So I think it's starting, and I think we have some opportunities to see it through.
And as we begin to see, success begets success. And so when you begin to see that the areas where they have these community alliances, which obviously makes sense, they have some resources that they can put into that. But the success is what I would focus on. I would like to say, whether you have an alliance or not, if it's being successful and we're keeping kids from getting into more destructive behaviors, I don't want them in the DJJ system. Who does? I was vice chair of the committee on DJJ when I was in the legislature when they actually had one, and one of our goals was try to what can we do to go out there to keep kids from being in the system, and how can we? It was a primary prevention aspect, which is difficult, but we looked at that, and it always comes down to some level of funding. And so I think as you show the success ratio across the state where people are seeing this, and we're actually seeing a lot of this now, a lot of the efforts of our community based care and our relationship with the department. Sometimes it's good, sometimes it's not as good, but we are working to keep kids from coming into care as much as we can. We would rather them stay in their families, and we would rather them get that wraparound support before them. There's the Fran Oil guy that says you can pay me now or you can pay me later. When you pay later, it's a lot more expensive.
Totally.
And so if we can get up front with a lot of this, so I think the legislature, was just meeting with a legislator right now, and we were talking about how we continue to put the message out there of doing these type of things that get into the prevention aspect. But I can tell you this, you can't wave a magic wand and make things and keep kids from coming into care, keep kids from getting into trouble, having bad situations, having families that have difficult situations that are drug induced or whatever. You can't just you have to have community strategy. And because Florida, and I love my state, because Florida has committed to community based care modeling, we have been able to make impact on that. Other states call me all the time asking me, what can we do to be more like you? And I wish I could give them answer that we've just arrived. We haven't. We've got a long ways to go. What you have said today, I'm so thankful we have you on camera doing this, because I'll be very candid with you. We need to get this message to the legislature. We need to get it to other communities. I want to thank you for doing this. I know you've taken time. I'm glad you're here at our conference. Hope you enjoy it. You're going to be around for part of it, at least, anyhow. Yes. And I look forward to finding out more on how we can present the findings, the messaging, the experience that you're learning. Again, you're on the vanguard. You're on the front end of this. You're the tip of the spear on as we're moving this. There's never going to be a day where there's not going to be kids coming into care. There's never going to be a day where families are not hurting. There's never going to be that. We can't have a zero number, but I can tell you what we can have. We can say where we are is unacceptable, and we want to continue to move the needle. And I got a conference of 600 people here that are dedicated to that mindset. I want to thank you. I want to thank you for being any closing thoughts.
Thank you for having me. First of all, I'm glad to be here, and I think that my closing thought would just be: don't be scared of inviting the community in. I think
Amen.
that's the message that I kind of, and I think, and I'm thinking back on just my own history and my own career, that I think there was a tendency to, you don't want to air your dirty laundry, and you don't, and that maybe there would be more problems by bringing folks in than there would solutions. But I've learned in this position, and really we're working with other people. They're hungry to come in and to help, and if we can guide them, then we, listen to them. You said it earlier, that we know folks are going to come in with their own perspective, and we want them to do that. We need they're experts in their own thing, the lived experts that have experienced the system, the school folks. I'm not a school board person, so I need their voice at the table. I'm not a crisis counselor, and so I need them as well. So don't be scared of bringing the community in.
That I like that. Don't be scared to invite people in. In fact, learn how to invite people in.
Mm-hmm.
In fact,
Great.
I would say this to all government leaders and people that are involved in this arena. Put it on the forefront of reaching out to people and asking for their input and help. Because if when we have community solutions, uh, get the faith community deeply involved in this. And I'm thankful that the governor's office has decided to move heavily into that area. That's a smart
Yeah,
move,
absolutely.
and we can do it. We can do it even greater. Get the business community, get the philanthropic groups that are involved in this, get them on your boards, and have them come in with a desire to say, we're going to move the needle to making a more secure and safe environment for all citizens. And when you do that, again, I think Florida's on the forefront. We're doing some really good stuff here, but I think we can get better. Thank you for being here today.
Thanks, Kurt.
You've done great. I wish you the best, and I look forward to talking with you more in the future.
Absolutely.
God
Thanks.
bless.